Thank you for being here today. I'm in Connecticut, as you mentioned. The last time I did my session, I was in Nashville, Tennessee, which was really nice at a conference. So I'm glad for all of you guys that are participating in this three-part webinar. If you haven't had a chance to listen to the other two, please go back in. Those recordings are available, and we're building upon each different co-infection. Last week was on Bartonella. This week is on Babesia. And I'm going to be sure, since it is the last of the three-part series, to leave more time open for Q&A, because even last time when I left about 30 minutes, I still didn't get through all the questions. Let's get started. Okay, so the disclaimer, Quentin already had given my background of who I am. And today, again, we're talking about Babesia. Most common, so there are definitely different subspecies of Babesia, just like we saw with Lyme disease and Bartonella and really any of the co-infections. The most common ones are Babesia microti and Babesia duncani. Very similar to malaria, and that's why you'll see the medication treatments often provided and/or herbs are typically ones that are anti-malarials. It's transmitted through a tick bite. It's also considered a blood parasite, also possible through blood transfusion. I thought that was important to note because I do know patients do sometimes ask that question about donating blood. What are the opinions about it if they have a tick-borne disease? But if you look at things like Babesia, can be transmitted that way as well. So typically it can cause small red in terms of on the skin, red or purple spots due to the skin bleeding and also bruises. So you may also see, and actually this is also possible for any tick-borne infections, but you'll see sometimes changes in things like hemolytic anemia, changes in red blood cell count, even potentially white blood cell count with things like Babesia or any of the or any tick-borne diseases rather. So again, causes small red or purple spots due to the skin bleeding and bruises. And many of the symptoms can overlap with some of the ones that you have with Lyme disease, including physical pain and joint pain and fatigue. But some of the peculiars for Babesia particularly is undulating fever, profuse sweating, chest pain, shortness of breath. So they'll often refer to it as like air hunger. So the person may not have asthma, but what you'll have a person say is, I feel like I can't take a deep breath in, or I feel like I have labored breathing. Or I've had patients where they say they're going up the stairs and they're young, and going up the stairs, just one flight wouldn't have been an issue before, but they feel like out of breath. So it's this lack of being able sensation to fully take a deep breath. Sometimes individuals will get chest pain or, palpitations. I myself, I had all Babesia, Bartonella, and Lyme disease. I would say my more significant symptoms were the symptoms from Babesia, which was profuse sweating. So it was constantly just hot. I felt I was like sweating significantly. And also it can be potentially connected even with things like anxiety. And so that's also tricky because with anxiety, you can also have profuse sweating as well. So you really need to get that information from that intake to have an understanding of, did they have this before? What's their history? If there is anxiety before or depression, did it get worse after getting this tick-borne illness? Did they have things like the sweating beforehand? Also, if a woman is perimenopausal or menopausal, getting that idea, the time frame to put it all into perspective. Headaches are also common. You'll see headaches also with Bartonella. Nausea. So a patient will say that they have this kind of feeling of the undulating fever, but just feeling flu-like, which you can also have with Lyme, but very common. Nausea is a common symptom somebody with Babesia may say, where they just feel sick all the time. And again, fatigue and joint pain can cause hemolytic anemia. And even in the highest severity of symptoms, a person can actually get jaundice. And if untreated, if someone actually has Babesia, it's untreated and they're having significant related symptoms, you can actually see changing and lowering of blood pressure and even liver failure. You will also see with patients with tick-borne diseases things like POTS, low blood pressure, liver failure, like long-term potential consequences if untreated. But these are all things to be on the lookout. But the most common symptoms you'll see are things like sweating, air hunger, shortness of breath, headaches, and this undulating fever. So this is just a picture here of what Babesia can actually appear like on the skin. A little bit similar if you see some to like that bullseye rash, but it's more of, like I said, like small red or purple spots that'll show on the skin. And as a reminder, and the stats have actually increased up. And I'm going to actually talk about this later in the class, but the most recent numbers showed they actually just produced it on PubMed on October 7th. So I'm glad because the timing was very ideal about Babesia. The numbers for co-infections now with Babesia and Lyme disease are around 41 to 42%. So, as a reminder, we have both direct testing and indirect testing. Most commonly, people are going to do indirect testing, testing for the antibodies to the bacteria, and direct testing, often done, you'll sometimes see in the hospital, or if somebody is not producing enough antibodies to show in the indirect testing, that's when the piece like testing, like PCR testing, fish testing, culture, things like that will be looked at, which is looking for the bacteria, parasite in the blood, active infection. So these are the ones available. IGeneX is one that we commonly use, available on Rupa that you guys can look up, and they actually will have all their updated panels listed. And these are some other inflammatory markers I like to look at, same as I do for Bartonella, because Babesia usually affects the mental state. So let's dive a little bit deeper. So if you, I'm just hiding this bar. This is just the map of locations of Babesia throughout the country. Has been detected in all 50 states. Obviously, the Northeast New England area more densely populated, but throughout the country. As I mentioned, it is a intraparasitic protozoan parasite that's transmitted by ticks, can possibly be through blood transfusion or transplacentally. It also shows, again, clinical features that it shares many of the clinical features that are common with things like malaria and can actually be fatal. So some people die every year of this disease condition. The symptoms definitely are more severe than expected if someone has Lyme alone, including, as I mentioned, things like undulating fevers, chills. I didn't mention that some people can get these like cold chills as well, in addition to the sweats. So as I mentioned, the most common ones, Babesia microti, Babesia duncani, also common, but microti the most widespread throughout the United States. And then there also are new variants getting picked up all the time. So when you look at the testing again, I mentioned the indirect and direct testing. IGeneX actually just recently this past year has testing for immunoblot for indirect testing. So before it was just the Western blot, that's now replaced by immunoblot. And they also have immunofluorescent testing. Available also are Babesia PCR testing, as well as fish testing, as well as the stain. Now, if you look at IFA, so that one was a common one used when we're looking at Babesia, but now it's great because there's access to things like the immunoblot. That was the most commonly used test for detection of antibodies and differentiates IgG and IgM antibodies response to Babesia, which helps you to determine either new, early, or late infection. So if you see it here, there's this pathogen that's fixed on the slide. They put these antipathogen antibodies in patient serum that binds to the fixed pathogens on the slide. And then these antipathogen antibodies listed here, these are in the human serum. So the fluorescent labeled secondary antibody you have here, and then what happens is this pathogen appears green when viewed under a microscope. And this is also the fish testing. So the accuracy of the fish test is 98.7%. So again, as a reminder, that is direct testing, looking at it inside the blood itself. These are some examples, if you see on the right side, of the fluorescent Babesia microti, as well as Babesia duncani and Babesia divergens. That is actually an example of a fish test. And the reason, this is just to note, one of the reasons it may be helpful, especially if somebody has many of the symptoms that are consistent with Babesia, but they're not testing positive, that there's a percentage that will not show or produce enough antibodies. That's when you want to look at the direct testing, fish testing. And this shows us data that if only IFA was performed, 12% of patients could actually be missed. And is one of the reasons why you might want to do, for example, the fish testing with IFA, or like the fish testing with an immunoblot, to make sure you're covering the full panel, especially if someone seems like they're presenting with the symptoms, but may have tested positive by way of the typical test. So you look at the IFA test, it detects antibodies that target Babesia in human serum. And these titers rise in the first 2 to 4 weeks of illness, and then they decline over the next 6 to 12 months. With Lyme disease, you'll often see it's a little bit later in terms of the rise that it'll show the antibody is going to show typically in about the 3 to 4 week time frame. So a titer less than 160 may indicate a resolving infection in patients also with the previously high titer. If you're looking at things like Bartonella, anything that's 1 256, 1:256, even if it's IgG, could indicate that it's an active current infection. Immunoblot used specifically to created recombinant proteins that are used and not proteins actually from cultures. And unlike the IFA, it can actually test multiple species in one test. So we could be testing for both microde as well as duncani in the immunoblot test. So I just wanted to share and definitely check out this link here, which you guys will have access to this PowerPoint presentation after. This was the article I mentioned that was released just on, or published rather, just on October 7th. That was actually a cohort study from 2015 to 2022. And it was about Babesia and prevalence and association of Babesia co-infection with mortality in the United States. So I just wanted to mention some key highlights of it, but this is just a link to refer to if you want some recent information because it was published again as a recent publication. So it does show that it increased in the study, in this cohort study, an average of 9% every year between 2015 to 2022. So every year there was an average of a 9% increase. And this is with Penn State at the research center. They attributed this increase to change in the length of seasons, temperature, humidity, and as well as rainfall. As we know, tick-borne illnesses can be found every single day of the year, much more common in the spring and the summer months when the temperature is warmer, and also that's a time when there's more reproduction. So they do believe that this potential uptick is because of the change in the length of the seasons and temperature as well as humidity. What they did find in the study, as I mentioned, about 41 to 42%, around that number, did have that co-infection with Lyme disease. But they did show in the research that there was no increased mortality having both Lyme and Babesia. And in fact, they actually suspected that having both of them may have altered the immune response to be able to more effectively fight infections. So the head key researcher had mentioned that they possibly think could actually having both of them may make it the body more able to effectively fight infections. And they didn't see there was any increased mortality by having both. Okay, so let's go through the integrative treatments. Many of the herbs are similar when you're looking at any of the co-infections, the ones that had been studied that have shown in vitro inhibitory activity, cryptolepsis and sanguinolenta, Artemisia annua. So those two as well, interestingly enough, are considered herbs that are like anti-malarial herbs. So cryptolepsis and Artemisia. Scutellaria bicalensis. I always mention not laterifolia because I think sometimes people interchange them, but the one that has been studied is the bicalensis. Alcornia cordifolia has also been studied for Babesia, and then Polygonum cuspidatum, which is Japanese knotweed. If you're looking at other protocols, which we've discussed in the other sessions with companies like Nutramedics, typically for Babesia, they look at things like certain antimicrobials like Ennula as well as Mora. So in terms of regular conventional treatment, Babesia typically is ativaquone as well as azithromycin or clindamycin and quinine. And these are just other common treatments that may be used. LDN going as low, I've seen as low as 0.25. I've seen as high as up to 6.5 or 7 milligrams to help with pain and also even improving sleep. Just mention these again, other treatments that are being looked at: hyperthermia, SOT, sauna, ozone therapy, HBOT. So these are some of the therapies that I mentioned before. So I wanted to make sure again that there was plenty of time for Q&A because we tend to run out of time with that. But I do also, this is my email if people want to stay in touch after with any particular questions. I also have this QR code which actually links you so that you can get access to a list of recommended laboratory work. that I'll usually do within my workup for patients with Lyme disease, including hormones, including looking at cortisol, including looking at inflammatory markers like IL-6, CD57, complements, autoimmune markers. So it has a list of my go-to ones that I tend to consider when I'm initially working up a patient. So now I'm going to leave it open up to Q&A. So I will open up the chat.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.